Hello, I am Wiyengis Woton Agada.
Hi, I'm Chidima Onozu, and this is
BHIS. Health, our priority.
BHIS, committed to your health needs.
This is BHIS TV, and it's just the next best session every single time. With me, we have a distinguished guest with us, and by my right is the very own um, CMD of NDUTH, which is the Chief Medical Director of the Niger Delta University Teaching Hospital. His name is Professor Johnbull. It's good to have you here, sir.
Thanks for having me.
And to my left is Dr. Akpe. Please pardon me. I'm getting used to it. All right. So with me is Samson, who's going to be anchoring this with me. And as I said, this is BHIS TV. We'll jump right into it. And our first question is, we'll jump right into it. And my first question is, sir, I'm starting with you, sir. Sir, you have been part of this journey with us, and how would you describe the journey so far with us, and what positive impact can you pinpoint that you have seen since you joined this insurance scheme?
So, thanks for having me. I believe that insurance is the best way to go because it's difficult for most patients to be out of pocket when they have health challenges, especially when they are in emergencies. When this scheme came on board, it was conceived by the state government. So when we started it as a tertiary health facility, it was quite embraced by all of us because we were expecting a lot of positive benefits on patients and also on the hospital. So far, it has increased our patient loads to the hospital, various departments. We are a tertiary hospital with core mandates of training of health personnel, delivering quality care, secondary, primary, and tertiary health services, and also to do research. So when we have increased loads of patients, it's quite welcome because it's really increase our finances, also our training of our health personnel, because we train various cadres of health personnel, medical doctors, to be nursing students, pharmacists, laboratory scientists, and all that. So it's a quite welcome scheme.
Okay.
We embrace it fully.
So
We
we
have some
can.
positive benefit.
So we can significantly say that this scheme has not just affected positively the patient, but has also affected every aspect of the medical care center. Right?
Yes,
We can
it
say
does.
that. All
It
right.
does.
Okay, so jumping right to the next one. Samson, do you have something to say?
Okay, Prof stated something very, very important, just like we've noted. He stated that insurance is the best thing that has happened to Bayelsa State because BHIS is for residents of Bayelsa State.
Yes, all residents.
All residents of Bayelsa State. So he said something really profound, and he said it's not just a release, but it cut across even personnel, so all personnel, and they're also benefiting from it. Then he also mentioned something. He said there's a surge. I think it has always been a challenge when it comes to people going to the hospital because of finances. So BHIS has now come in to make it easy for people to go to the hospital to seek Medicare, right? So now he said there's a surge. It is understandable because as at last August, the total numbers of enrollees is 217,000. Right, so in my head as a data analyst, I was looking at the various sectors, the formal sector, the formal sector has about 53% of that figure covered. Then we have the vulnerable groups. The vulnerable groups is about 44% of that. So now the informal sector has now been incorporated. It is the largest because we have different, it's larger than these two groups I've mentioned. So by what I saw, by the figures, is so far just 2%. Because it's understandable, because it's the informal sector just got incorporated into the scheme. Now the surge is also there already. So it simply means we are going to have an impending surge because this podcast it's part of the awareness we are creating. We are sending this message to residents of Bielsa to know what BHIS is about and the importance of the scheme. So we are going to have more surge. So Prof, the question is, how are we prepared to deal with this surge?
Well, that's a very good question. Let me take you back a bit. Following the increased number of patients, when we adopted the scheme in our facility, we even had the issues of challenge of clinic spaces.
Clinic spaces.
Yes. So we even collected a loan from the outside insurance scheme to build a one-story building that I've been doing the BHIS building. Yes. So it's one of we are trying to see how getting prepared to cope with the number of patients that will come now that the informal sector is being incorporated in the scheme. So we are quite prepared, to handle any number of patients because we have many departments with various specialties, so many fields of medicine. So we can cope. We are prepared. We are prepared to cope with any such. We further sure that we come to our hospital because it's going to be beneficial to us and also to the people. And it's a tertiary health facility and it's a reference center. So we're expecting that now that the state government is trying to, innovate a lot of hospitals in the rural areas, making them functional. And the President Commission of Health is trying to strengthen the health sector. Also, the referral system too is being strengthened. So we are expecting that we have more referrals even from the rural areas to our facilities. So we are prepared.
That's beautiful. The BHIS, which is the scheme we're here talking about, has we have this tagline that says your health is our priority, and if you know that health is wealth. So that even leads me to the next question I was about getting into. Thank you, Samson. That was quite insightful, and thank you, Prof. The next question I was about to ask is, how has the scheme influenced patients' access to care and overall service delivery in NDUTH? But that has already been answered. So I would be moving to you.
Well, I want to just...
you want to chip in?
Yes,
okay.
I think what I would want to add when it comes to the side of the patient is that it has changed the health-seeking behavior of our people.
Wow.
Health-seeking behavior. Especially among pensioners.
Pensioners.
Yes, it has really changed their health-seeking behavior. Before this time, an average pensioner is ill, will not come to the hospital.
Wow.
Because of this out-of-pocket payment challenge. We go to faith homes, chemists, and all that. And before, but most times they will only bring such patient to the hospital when the condition is very critical, when they are even about to die. So it has really changed the health seeking behavior of our people. And that's very, very important. Because some patients have realized that they are sick, they can come to the hospital and have treatments without paying out of pocket. So that has really encouraged a lot of them to come. So that's also a big advantage to the people.
Oh, that's amazing. That's really amazing. So, is there any significant success story of any person that has enrolled in BHIS that you want to share?
Well, thank you very much. BHIS is 8 years old this year. We currently run 4 programs.
4 programs.
Formal sector, informal sector,
Okay.
the schools programs, and the vulnerable population program. Now, under the vulnerable population program, we have 4 sub-programs. The BACPF, Bioscience Equity Fund, UNICEF Gavi and BHIS collaboration, and then the BHIS Global Affairs Canada Clinton Health Access
Okay.
collaboration. So these are the 4 programs. Like Samson said, it's over 217,000 enrollees. That figure has increased. It's over 220,000 now.
That's as at August.
All right.
That
So it's
means-
over 220,000 now.
Wow.
So,
Wow.
so it goes
There are a
up.
lot of success stories if we have to share. A lot. In fact, last Friday, last week, was it Thursday or Friday, we were at Johnbull Health Center opposite St. Peter's, and we met with 4 of our vulnerable population enrollees under our VPP programs, and they had a lot to tell us. You know, the stories are numerous. In fact, I remember this one. This one really got to me because then I was still new with BHIS. We met her at Crest Hospital, and she had this massive menorrhagia, and she had been transfused, but apparently she needed to do a myomectomy. She didn't have the money. She's a teacher, secondary school teacher. She didn't have the money. What did she do? She went to borrow funds. So when we met her, we're like, you have any complaints? Went out for continuous utilization monitoring, weekly continuous utilization monitoring exercise. So we asked her, do you have any complaints? She said no, except that she doesn't know how much she's going to pay for the surgery. I said, what surgery? She said myomectomy. And that she had already borrowed 100,000 first to deposit. So I asked her, the transfusions you've done, have they collected money from you? She said no. So why are you borrowing money for the myomectomy? She said she thinks they would ask her to pay, maybe at the end of everything when she's been discharged. So I told her you will not be asked to pay. I had to call desk officer to reassure her, and this woman was practically in tears. She was so excited. You know, that's just one of, we have a lot. Some of them, like for our VPP program, they just go to the hospital. They get attended to. If they have to be referred, they do a referral, they send them, and they go home. They don't pay anything. Those ones, everything is covered, unlike the formal sector, informal sector, where there might be co-payment or co-insurance attached to it. The VPP programs are completely free, as long as the services are provided according to the benefit package. So there are myriads of them.
So you can see that BHIS is dealing with the main issue, which is not sickness per se, but the sickness of ignorance. Ignorance is one thing that has kept people from going to the hospital. You could see that this scheme has brought about a surge in the way people want to seek medical help because they know that health is actually wealth. So thank you so much, Dr. Akpeki. I got it now. I should be congratulated for this one.
BHIS, committed to your health needs.